Well, we've got a lot of information to get going through, so we're going to go ahead and get started. I'm going to be periodically mentioning the slide number so that if you need to step away, just listen. The slide number can be found in the lower right-hand corner of the slides. First and foremost, we're still looking at the October 1, 2015 implementation date. We had no legislation this last spring that when we had the change in the sustainable growth rate formula, the legislation that eliminated it, there was nothing tacked on there that will delay it. And as it stands now, we're still looking for a single implementation date. There's a couple of proposed bills that have been put up that there was maybe some type of a grace period. As it stands right now, as of today, there's been nothing passed, and so we're still looking at a go-live date of October 1, 2015. With no grace period. For physician reporting, it's going to be the base date of service, no matter where the physical location is. So if your pain management physician is seeing a patient in the office, is seeing the patient doing a procedure in the ASC, or even seeing a patient in an inpatient setting, maybe doing acute postoperative pain, the determination of whether we use ICD-10 or ICD-9 will be that date of service. The date of discharge is only for the hospital, the inpatient facility reporting. It will not be for physician services in an inpatient setting. It's only going to be for the inpatient hospital. And so if your physician were to see a patient in September, this coming fall of 2015, say September 28th, you would bill that out with an ICD-9 code. If they then saw that patient October 10th, then you'd bill that date of service out with an ICD-10 code. If for whatever reason that you need to, say, resubmit that September 28th, it was billed to the wrong insurance, it got denied, you needed to do a correction on it for whatever reason, that September 28th date of service still needs to be resubmitted with an ICD-9 diagnosis code because it's based on date of service, not date of billing. Now, be aware that in some cases when you're getting pre-authorization during the month of September and you're getting for dates of service in October, so the authorization is for dates of service October, you may need to use the ICD-10 codes to get that pre-authorization. You'll want to check with your payers to see if they're going to link that October date of service that you're getting the pre-authorization for with the ICD-10 code, and in that case you may need to use them. Well, now shifting on to slide 3, I just want to do a quick comparison of I-9 versus I-10. And so when you're looking at that, the ICD-9 code, and I've given you that it's 338.28,